Today, we're going to talk about how something as simple as a trip to the dentist can actually become a really high-stakes medical event. We're going to focus on oral health for two very specific groups, people with hemophilia and women who are pregnant. So let's just jump right in with a question. When is a simple dental visit a high-risk procedure? I mean, for most of us, it's just a routine checkup, right? But for some people, it's a situation that needs really careful planning and specialized knowledge to prevent some serious, even life-threatening problems. All right, so here's our game plan. First, we'll look at why oral health can literally be a vital risk. Then we'll dig into how really common issues can have some pretty severe consequences. After that, we're going to focus on why prevention is hands down the best treatment, check out the special protocols for dental care, and finally, wrap up with the super important role that you play in your own oral health. Okay, part one, oral health, vital risk. This is all about why your mouth is truly a window to your overall health, especially when you have certain medical conditions. So we're looking at two very different groups that actually share this elevated risk. For people with hemophilia, that's a genetic disorder that stops blood from clotting properly. Even a tiny nick during a cleaning can cause uncontrollable bleeding. And for pregnant women, well, hormonal shifts can totally change the game for oral health, which, as it turns out, is directly connected to the health of the baby. Moving on to part two, common problems, serious consequences. This is where we see how everyday stuff, like a little bit of plaque or sore gums, can quickly escalate into a major threat for these folks. You know, it all starts with plaque. You can see right here how this sticky film of bacteria just builds up on our teeth. If you don't get rid of it, it starts attacking your tooth enamel, hello cavities, and it irritates the gums, which leads to gingivitis. That's just a fancy word for inflamed, bleeding gums. This right here is the root of all the serious problems we're about to get into. And for somebody with hemophilia, the stakes just couldn't be any higher. The World Federation of Hemophilia puts it in no uncertain terms. Bleeding after a dental treatment can cause serious or even fatal complications. So that simple gingivitis that makes your gums bleed a little, it turns a standard cleaning into a high-risk event that needs serious medical planning. Now let's switch over to pregnant women. The challenge here is different, but it is just as big. Those hormonal changes during pregnancy can make the body's reaction to plaque way more intense, making gums super susceptible to inflammation. In fact, it's estimated that a staggering 40% of pregnant women have some kind of periodontal or gum disease. And here's the kicker. This is not just about the mother's comfort. Not at all. Research has drawn a direct line between gum disease during pregnancy and some really serious outcomes. We're talking about things like premature birth, a baby being born with a low birth weight, and even preeclampsia, a really dangerous pregnancy complication involving high blood pressure. So, with risks like these, what's the answer? Well, that brings us to Section 3. Prevention is the best medicine. The absolute best way to handle this is to get ahead of it. So let's talk about some simple strategies to protect your health. The World Federation of Hemophilia lays out these 4 pillars of oral health, and honestly, they apply to everyone. It all starts with your diet, cutting back on sugary foods and drinks. Next up is cleaning, brushing really well with fluoride toothpaste, and yes, flossing twice a day. Then there's fluoride, using products that shield your teeth from decay. And last but not least, regular visits, seeing a dentist at least once a year. This is your foundation for hopefully avoiding any major procedures later on. All right, Section 4, dental care, a special protocol. So when you do need to get professional treatment, it has to be done safely. Let's take a look at what a safe dental visit really looks like for these groups. You know, for pregnant patients, even something like the position of the dental chair is a huge deal. During the first trimester, the chair is set back to about 165 degrees. This is all about comfort and safety during that really delicate early stage of the baby's development. Now check this out. When we get to the second trimester, the chair gets lowered just a bit to 150 degrees. This time frame is actually considered the safest window to get any necessary dental work done because the risk of complications is at its lowest point. And then for the third trimester, the chair is brought up to 135 degrees, so it's more of a semi-seated position. And there's a very specific medical reason for this. It's to prevent something called supine hypotensive syndrome, which is when the weight of the uterus can press on a major vein, mess with blood flow, and cause a sudden, scary drop in blood pressure. Now, for a patient with hemophilia, the most important protocol has nothing to do with tools or chairs. It's communication. This isn't just a list, it is a lifeline. Telling your dentist the type and severity of your hemophilia is critical. Letting them know what meds you're on is vital, since some common painkillers can interfere with clotting. Having your hemophilia treatment center's info on hand means your dentist has an expert they can call, and mentioning any other conditions, like inhibitors, that changes the entire plan. This teamwork is absolutely non-negotiable for a safe outcome. And all of this brings us right to our final section, your role in your oral health. Because really, the power is in your hands. At the end of the day, it all boils down to this one powerful idea. The most important objective is the prevention of complications. Whether we're talking about avoiding a dangerous bleed or protecting the health of an unborn baby, being proactive and communicating clearly are, without a doubt, the best tools we have. So we'll just leave you with this one question to think about. Are you giving your oral health the priority it truly deserves? Because for every single one of us, and especially for those in high-risk groups, the answer to that question can make all the difference in the world.